want to share with you the experience I've had in my clinical rotation. In this clinical rotation, I was assigned to go into internal medicine. In short, internal medicine is a specialty where we look at adult patients that are suffering or ill in a wide variety of systems. This can be either neurological, gastroenterology, infectious diseases, cardiology. There's so many different systems within internal medicine. We don't only focus on one, but basically the whole adult patient, and manage them, provide treatment, and overall with the goal of getting a patient back to full health. Our schedule for our time in internal medicine went as follows. We had a 2-month period in internal medicine. So basically our schedule every morning at 7:30 we were expected to be in the hospital, and around 8 we had our morning staff meeting. So basically the morning and the night team, we're all there together, and the night team is sharing the information to us who's coming for the day shift, so that we are at least up to date on the different patients, and we can then provide the further management for the day. So that meeting usually would last about max an hour. Once we have received that information from the team that did the night duty, that's when we now break out and we go on to check our patients. We were divided into the different wards. The wards were divided by gender, so there's a male ward, female ward, and so on. And what we were required to do, we were required to go and see our given patients. On the first day, I was expected to get the full history of my patient and as well come up with a treatment plan. So just to explain it a bit more, we'll first have to get a history, full history, and the physical exam done. Thereafter, we'd come up with 3 differential diagnoses based on the history and physical exam that we have done. And then once we have those 3 differential diagnoses, that would lead us to look for potential investigations that could be done to help us pinpoint the final diagnosis that that could be causing issues within our patient. At the point of investigations, we'll then present that to our senior doctor, and if he is pleased with what we have done, we can continue further to recognizing the final diagnosis based on the results of the investigation and the physical exam and the history we have received. And once we have the final diagnosis, we can then move on to formulating a treatment plan that can be used for our patient. On the normal days when we don't have to take full history, we do the follow-up notes. We use the SOAP note method, where you have the subjective, objective, assessment, and plan. And there's where we document and also record the progress of the patient's health since their arrival to the hospital. An interesting case I had, he was really sick, came into the hospital with difficulty breathing. He would lose his breath with just simple movement. For example, walking around the house just to go to the bathroom and back would knock him out. You would see him sweating, and his SpO2 was really low, was always in the 70s, and he would always be gasping for air. So we did a chest x-ray. There was some opacities seen in the lungs. As a result of his history of having these chronic diseases such as HIV and developing TB as well, he developed lung fibrosis, which is basically where the lungs are no longer as, if I can say, flexible. The tissue becomes very hard, making it very difficult for him to breathe. He had a lot of hope. It was sad seeing that. He was on oxygen, which helped him a lot, but it seemed to be that he would need to be on oxygen constantly for the rest of his life, which was a sad diagnosis. One thing I can say I've learned is the need to be patient, to be respectful, and having emotional intelligence, just knowing when and how to interact with someone who is suffering. However, one thing I did notice about myself is that I realized in myself that I've forgotten a lot of basic medicine. Not to say it's completely lost. Like, if you say the word, it clicks, right? But I've seen that there is a need to constantly go back and reread and remind myself of what we've gone through and how things work, so that I can apply it accurately in the hospital. Especially in internal medicine, there's so many systems involved and they're all connected. I think it's in these moments where I realize, like, I don't know anything and I need to go back. And honestly, internists, they really have a good understanding of the human body, and it's admirable. Any advice for anyone going into internal medicine rotation? One, be ready for many different systems to be involved. Don't be afraid not to know, especially if it's your first clerkship. You're there to learn. Be ready to go back and review a lot. I would suggest having a little notebook. Any question that you may have, write it down. Any sort of information you receive that you're not so sure about, write it down. Literally just being able to reflect back, and once you get back to either the dorm or back home, read up on it, so that when you come back tomorrow, you at least have a better understanding of the situation and you're not completely lost. Like, be open to ask questions. Sometimes you may get a lecturer who's going to be tough and
say, what do you think?
You know, and yes, there are bad answers. Some answers may be wrong, but we're here to learn at the end of the day. So you'd rather be corrected now than make the mistake out there and get sued. Anyways, thank you very much for watching this video. This was just my experience on doing internal medicine, so it was really good. I learned a lot. If you are currently in your clerkship, please share your advice in the comments below. I believe there's many of us who are still in the pre-med phase or the basic sciences phase and are curious about how they can prepare and what it is like in clerkship. So thank you for watching. Stay healthy, study hard, and yeah, see you in the next one.